Right, next we have Paul Moulton from Isle of Man Television. Paul, good afternoon, Fast am I.
Good afternoon. This is for the Health Minister. I need to revisit this letter yet again, and I need to know, or I'd like to know exactly why you didn't think this would at some point be very, very important evidence, because you've read out a letter that cannot be substantiated at all. You made allegations about Dr. Glover, you made allegations about the press, and as I'm sure you're well aware, the word is out there that you potentially could have written it. Now, I'm not saying that, but don't you feel that this was incredibly important and you should have taken advice potentially to keep it? And once the freedom of information was in the system, it therefore comes actually relative that you have to keep it. Am I right on this or not?
Well, firstly, the letter was disposed of before the Freedom of Information request came in, Paul, so that needs to be absolutely clear. Actually, under Freedom of Information, you don't have to keep it once the request comes in the system. There are actually reasons why you can dispose of it while it's in the system, but you have to make clear what those reasons were. In this instance, the letter was disposed of as soon as the purpose was completed. I'm a bit concerned, though, that you say allegations about Dr. Glover. I don't recall there being any allegations about Dr. Glover in that letter.
It was trashing. It was trashing her to some degree. It also made the press look like we were very vilified by what you read out. It's unsubstantiated. What you've done can never now be checked because you haven't got any proof.
Paul, all a Freedom of Information request would have done, even if the letter was still here today, is release the text of the letter.
Do you regret it now?
No, I apply I've just said I'm a data controller. I apply the data protection principles, and one of the central principles of data protection is that correspondence should be retained until the purpose of that correspondence is completed. The purpose of the correspondence.
So you think it's fine to make these allegations, which you're reading third party, without having anything substantiated and putting it in the public domain, and then getting rid of the proof or the evidence, whatever you want to call it? Shocking, isn't it? I mean, how it reads to the public. You're saying everyone should be completely honest and open, and then this is clearly the opposite of that.
Yeah, well, can you not interrupt when a minister's trying to answer, please?
Well, I can't tell because of the Zoom thing. I can't hear anything. So sorry if I am, because the way we contact each other is obviously on a delay system. So my apologies.
If I can get a word in edgeways then, Paul, as I stated at the start, I'm a data processor. There's no difference being applied to this letter than I apply to any other piece of correspondence that I receive. So I gave an example there that when I receive a compliment, say, about an area of the department, those type of letters, they're actually shredded same day. Because once the purpose has been passed on, I receive other types of correspondence where people don't actually need a response to the correspondence. They're just actually writing to me to either say thank you for something or something else. Again, those correspondences removed and got rid of same day. I don't apply any different processing to anything I receive. I keep a consistent line in line with data protection principles.
Okay, and I'd like to know about just people flying in away now for their transfers for the patients who are going to the UK. Apparently they're going out quite early, coming back quite late, and quite often they're having to stay outside the hospital, which is causing anxiety. Any comment on that?
Something we are looking at. It's something I have raised myself within the Department of Health and Social Care, particularly obviously because we use North West hospitals and with the transmission rate that's up there now. It is a long day for a lot of people, and we are looking to see what we can do about that. We are obviously limited because we are bound by the times of the flights of getting people in and out, but it is something I've raised in the department. I've had several people this week on to me about it, and we will look to see what we can do.
Okay, and my apologies for talking over you, but honestly, we can't tell when we're doing it on this Zoom thing. It's quite difficult to know when.
Well, we've got our longer panel debate on Sunday, Paul, and Saturday. Sorry.
I'm looking forward to seeing you, David, on that.
Please like and subscribe to the Isle of Man TV channel. Thank you.